Hey everyone, this is Dr. Belinda Wilkerson from Steps to the Future, coming to you with this week's College and Career Conversations. I am so excited this evening to have the guest that we have because she's going to tell us about a career pathway that I don't think many people know about. And in addition to not knowing about it, I don't think they understand the importance of it. So this is not only going to be educational and informative, but it's going to be so interesting. And in the times that we're in right now, when we're looking at what happened Wednesday in our nation's capital, this is a conversation that is so appropriate, so on time. It's funny because when Angela and I were looking at dates, or when Angela was looking at dates, we didn't know that what happened Wednesday was going to happen. So grab your cup of coffee, grab your tea, grab your snack, grab your water, grab something healthy, and come back and join us in about 30 seconds. So thank you, everyone. We're back with my guest tonight, Angela Tatum Malloy. Angela is a doula. She is an international board certified lactation consultant. She's also the executive director of Momma's Village. She runs the Fayetteville Breastfeeding Center down in downtown Fayetteville. She does a lot. I am Angela. Thank you so much for agreeing to be here this evening. I know you are an extremely busy woman. So I'm thrilled that people have the opportunity to see this broadcast and have this conversation with you. So I also like to start out with asking my guests to tell us a little bit about their education and how they got to where they are today. Because sometimes, your education doesn't always seem like it has that linear, that straight pathway.
No.
So I would just love you just tell us about who you are and what you're doing.
Okay, so again, my name is Angela Tatum Malloy. I am a Fayetteville native, born and raised here right at Cape Fear Valley Hospital. I went to Douglas Byrd High School where I graduated, and then from there went to Fayetteville State. And that's where I decided, because I really enjoyed numbers and math and accounting. And so I decided to major in accounting with a minor in business management. And, my focus was that I was going to one day work as an auditor with the IRS down in Atlanta, Georgia. Those were all my plans. And then fast forward, got married, had a family, raised the children, homeschooled them all up until the first one went to college at Methodist here. And then I decided to go back and get my master's degree in teaching and began teaching at Fayetteville Tech Community College, teaching English and also math. And then I got remarried, had another daughter, got back into breastfeeding, and realized that there were a lot of problems in the breastfeeding community. That's what led me to this career, starting out as a lactation counselor. I was doing a social media page, and they liked my answers. I just answered just how naturally and organically I did as a mom. And she asked me, did I want to be a moderator? And then I saw some letters behind her name, CLC, and I didn't know what that was. And she said, oh, I'm a certified lactation counselor. I'm like, oh, they have a certification for that? So I decided to get that certification. And then she was telling me that she was studying to be an international board certified lactation consultant. And so I was like, well, the CLC must be like the bachelor's degree for breastfeeding. So let me go for the master's degree version, which is the IBCLC. So did my training at UNC Chapel Hill, where they had the first accredited lactation program, not just in the United States, but in the world. Finished there, and that kind of led to my path of being a lactation consultant and, you can't have breastfeeding without having to have given birth, and finding out some of the disparities and issues that we have in the birthing community. That's what led me to host a doula training, become a doula, and then eventually become a doula trainer. And that's where I am today.
You know, when I listen to all of that, I'm like, oh my God, you know, when I had, when we had our two sons, I really could have used somebody that was a lactation consultant, because that was one of the hardest things I had to try to learn how to do. But just listening to you, and listening to the education that you've had to get there, the fact that you pursued additional certification, this is, I love bringing people like you on, because I think it's so important that students that are in high school, students that may be still in college and still trying to figure out their pathway, understand that this is a possibility, that this is another pathway in the healthcare field, and it's one that is rooted in social justice. It is rooted in social justice, and so many students go into healthcare or go into other fields because they really want to look at the issues of equity and the issues of social justice, and this is like smack dab in the middle of it. So tell me what some of the training was like. You know, what were some of the things you actually had to do to get your certification? What does that look like?
So that's the unique thing. This is, and when I say a fairly new profession, when you look at all of the other professions, especially the ones in healthcare, you're looking at several decades in that profession. And for a lactation consultant, it's only been about 30 years. And for those that are familiar with different professions, especially in the community, 30 years is fairly new. And so there are three pathways that are that lead to that. They can be a little challenging and problematic, and so I do host twice a year an explanation of the pathways of how to become a lactation consultant. Those three pathways include, if you're already in healthcare and you have a license like a nurse or a doctor or a registered dietitian or what have you, then they will count your experience in the medical field if you're working with mothers and babies. And so you can do kind of a self-guided where it's not mentored, and you don't have someone that is following you along with your clinical hours. And so that's one way, because they figure you're in the healthcare field, you're doing the studying of the subject. And so you just use your experience of interacting with mothers naturally, and you get your clinical hours that way. Then you have the second pathway, which is what I did, and that is a university-based pathway. And there's only 5 or 6 in the country, so that can create a barrier as far as access. Now, what has happened, there's a lot of negatives with 2020 and COVID-19, but one of the positives is it actually made the clinical experience more accessible, because it allowed virtual clinical mentorship. And so that was able to make it more accessible. Then there's the third pathway, which is you have a mentor. I am a Pathway 3 mentor, and that is an IBCLC that you follow or shadow, or you get your clinical hours from, that's required for you to sit the exam. All the other aspects are the same. You need the 90 hours of lactation education. You need your health science, your 14 health science classes, and then you sit the exam. The exam is offered twice a year. And after passing, then you are a certified lactation consultant, and you're able to work in various platforms as far as either the hospital. Not all hospitals will hire a non-RN IBCLC, but there are some that do so. You can work in public health. You can be in private practice. You can work in a clinic setting. So there's various avenues. We even have some IBCLCs that have combined their own, their other degrees, such as anthropology or other fields, and so they get more into the research aspect of breastfeeding and lactation education. So yeah, there's various things that you can do, like you said though, but a lot of people are not aware of this particular profession or how to merge it with what they currently are already doing that could be an asset to them.
Right. Thank you so much for that. For all of those folks that have joined in, thank you so much. We have Angela Tatum Malloy with us, who is a doula and who is an international board certified lactation consultant. Please, if you have any questions or comments, throw them into the chat and we'll make sure we get them here. And I just want to thank one person that's already commented, Jenna Richards. She's giving a shout out to you. So thank you, Jenna,
she's way in Australia.
Oh my goodness.
Yes.
Wow.
Yes.
Thank you so much, Jenna. You really just made an effort to tune in. Definitely appreciate that. Mm-hmm. So anyone else, if you have questions, comments. Now, Angela just gave us a lot of information about the different pathways and what have you. You can always listen to this again, but this information, I will have this information in the show notes within 48 hours so that you can always go back and get that information. We have another comment here. This is a family member. Thank you so much, Kara. Kara's talking, how awesome. She always thought she would love to do something like that. But right now, Kara's a first grade teacher. She's also a full-time mom too.
Yes. And as you know, teaching is where I started.
So she had a lactation consultant.
Oh, wonderful.
Hey, Kara, I didn't know that. That's so interesting. Thank you so much for sharing that with us.
Yeah, and that is interesting because, when I was breastfeeding my older children between 21 up to 28 years ago, the four of them, I had no idea that there was such a thing as a lactation consultant or breastfeeding support groups. I just kind of figured it out. But, there is a community out there of lactation consultants, of support groups, and also the online support groups. And, they are positive, but we also, it's kind of a catch-22 where, we want our families to get their clinical support from a trained lactation professional, and then their parent-to-parent support from those birthing groups and breastfeeding groups. So, and I happen to be a part of several different groups that are online that offer support, some really good support for the parents.
Okay, that is so good. This is probably, for me, out of the careers where I've interviewed people, this is the one I knew the least about. So I'm really thrilled that I had the opportunity to do it. And folks, you'll see coming across the screen, different social media handles, where if you have more questions or you just want to follow Angela to find out more about the work she does, or if you want to refer somebody to her, you'll have all of that information. So that'll be coming across the screen, and you'll also see that in the show notes. So Angela, tell me about because my first, as we were talking earlier, my first introduction to you and the work you do was when we were occupying space in Revolutionary Co-working at the same time. And I remember saying, lactation special consultant? Okay. But what was so neat was seeing the moms and the babies coming up the elevator to the office. So that was kind of like a nice break to see that happening. So tell me about your progression in starting this work.
Okay. So, while I was in my lactation training program at UNC Chapel Hill, there, with anything else, you have your big spring project. That project, for a lot of people, is called their capstone, or, whatever that is when you're finishing up the program. And for mine, I chose it to start a support group. And I was introduced to an organization that provides grant funds to start that support group. So I was given $2,000, and that was supposed to provide like some incentives and provide food for the parents. And we started out at Prima Elements doing support group meetings. Now, this was before I was certified, so I wasn't doing clinical work, but more of a support group, very similar to what La Leche League does. And from there, we went from growing and having our support group to being able to offer consultations. In the beginning, it was self-pay, and that was kind of challenging because, like you said, Dr. B, this is a new profession. It's a new healthcare service that is available to the community. And a lot of people don't know how to fit that in.
Right.
And then when you say you have to pay out of pocket, and then when you're saying you have to pay out of pocket and it's between $90 and $150, it's kind of challenging, especially for new families that are, welcoming a baby and all the other expenses. So I knew immediately that that I really wanted to work hard in being able to bill insurance. That is very challenging to do. A lot of insurance companies, they want you to either have a license. And again, so the International Board Certified Lactation Consultant, it's a certification. There are several states in the country that have moved to make it to have a license, but North Carolina is not one. So it can be challenging when you're dealing with insurance companies, with payers that are used to credentialing healthcare providers that have licenses, and trying to get them to understand that this service, even though it's a certification, warrants being able to be covered by insurance as well. So we've made some progress in that. About 2 years ago, Medicaid finally allowed medical billing for lactation services, and that was a huge plus. Now, the downfall is instead of me being able to bill directly, you have to bill under a nurse practitioner or nurse midwife or physician, which you rarely use a physician because of the expense of having a physician, but you have to have a licensed provider that is recognized to be able to bill under that person. And for Medicaid, they have additional requirements where the provider has to be in the clinic when you're providing those services. So, that's, then that's still a challenge. It's ongoing. Excuse me. With doula support, it's not covered at all by insurance. So that's a current thing that we're working on and advocating for, and we are making progress as well. I'm looking to that probably by summer, end of the year, that we could possibly have medical coverage for doula services as well. TRICARE has just started a study that they are looking in providing coverage for doula services and lactation without requiring a licensed provider to supervise the doula or lactation consultant. So that's promising, because once we start having our government payers cover a service, our private insurances are, sure to follow. So that's good that Medicaid and TRICARE are stepping out and being the first to cover that as a covered service under your insurance.
Okay. That's great. That's great
Yes.
information to have, so that people who may be thinking about how do they make a career out of this, you've already created the a template for people.
Yes.
So this is definitely something that people can do, and you've already uncovered some of the challenges. And some challenges remain, but you've already put some of those things into place. So that's really good. So tell me a little bit about, or not a little bit about, tell us about Momma's Village.
So that's where my heart is. And, we have some big surprises that's going to come in the community in March. And so with that, what we're looking to, Momma's Village is exactly what it says. It's getting that village mentality back into our community. It focuses on Black and brown families in the community who are birthing, breastfeeding, because as many people have heard, and I don't have to, we're at the point now where we don't have to go over all the statistics. We know that there are disparities in every aspect of our systems, and that includes our healthcare system. And so here in Cumberland County alone, we have our Black babies are dying up to 3 times more than white babies in the community, and our mothers are dying almost double, between double and triple the amount of white mothers in the community. And even though you may have some that may say, well, we have improved on our maternal mortality, but our infant mortality increased. And what I had to do was to kind of put that in perspective. And when you think about that, that just means that we are saving more mothers, but we're sending more mothers home without their babies. And so that's how you have to think of that. And so with that, we know that the common factor is systemic racism. And it's not because the mothers are not having the right diet, that they're overweight, because we know that those health issues are in other communities as well, and they're not dying at the same rate. So and that's why you're going to see a lot of emphasis in focusing on dismantling racism in systems, because we know that is the common factor. And we know that when you have representation in whatever field you're in, but for today's conversation in healthcare, that helps to lower those disparities. Now, it doesn't eliminate it, because we do have some, I like to explain to people that just because you have someone that's from the community, and in this particular situation, the Black community, it does not mean that their training has allowed them to be able to support families, Black families, how they need to. Because if the training is from a systemically racist training, then that's how you're trained. And when you go to rely on what you need to do your job, you're going to rely on what your training is. And so that's why we need to get more representation in those that are offering mentorship for IBCLCs, those that are doing doula trainings, so that we can have people that look like the people that we're serving, so that we can begin to have people that know the problems in the community and providing the answers for their own community. And you tend to find the answer a little faster, and you have a little more passion when it's coming from your village. Your village is like your family, and you're going to seek to make sure that your family is well. You want to see others well, but you're going to make sure that your family is well. And so Mama's Village, the goal of it is just to be a resource for the Black community. And it started with breastfeeding, it morphed into doula support, and now it's literally everything. Education, because I homeschooled, so we get a lot of parents wanting, especially with this new way of remote learning. I did some Zoom meetings for parents, trying to help them. So with education, with connecting back to our spiritual roots, that includes, that's African-centered. And so my goal is to make Mama's Village like that resource in the community. Our future goal is to turn it into a Black birthing center here in the community, where our mothers who are finding the Black doulas, but they're not finding Black midwives, so that they can have the births that they seek to have with providers that look like them. So that's the long-term goal. Putting it out there.
That's great. That's right. Speak it into the universe so we can have it happen.
Exactly.
It's one of the things, I'm a big sports person, in our house of, all males and just me, the lone female, except for my cat. I was reading an article about Serena Williams. And she was talking about the issues that she had postpartum and the systemic racism that she faced. I mean, I don't know how many people know, but after the birth of her daughter, she came very close to dying. She came very close to dying. And in the article, she reported how she kept telling the physicians that something was wrong, She was telling the healthcare worker something's wrong. I don't feel, and was giving them all these symptoms, and they just kept ignoring it. Well, you'll be okay. We need to do this and need to do that. And it turned out that she had a serious condition that would have killed her if it had gone untreated. So here is somebody in the community who, so when I hear people talk about, well, it's income related, and no, it's not, because, you always have folks who are trying to say, well, what about? No, this was systemic racism. And it didn't matter that she was Serena Williams, tennis champion that, been on multiple covers of Sports Illustrated and what have you. It was systemic racism. And then I read something also where Beyonce talked about some issues that she had during her issues after childbirth. So again, I think it's really important that people understand that this is a serious problem. And I know one of the things I'm going to include in the show notes are some articles that people can link to and read, because I think it's important that we know this and understand why it's important to have a career like this, why this career pathway is so important to people. When you talk about the statistics that you talked about, in this day and age, that's crazy.
Yes.
That's absolutely crazy.
Yeah. And, with that, talking about the incident, you will see a lot of times, Dr. B, I wear a pin that says, listen to Black women. In my daughter's room, whenever we were, when I was supporting her birth, I had a word, one of the word boards, and it was trust Black women. And the reason why that's so important is because that's what happens. That's what happened with Serena Williams. They don't listen to Black women when they tell them. They discount it as wanting, either extra medication or wanting services that are not necessary, deemed by the physicians. And so that's where we have, dangerous situations where our mothers are dying because they're not being listened to. And that's why they're wanting doulas, mainly because they want to make sure they should not be fighting to have their voices heard while they're trying to give birth to their baby.
Right.
And that's the sad thing, that we have mothers that are having to fight to birth a healthy baby and fight to stay alive and fight the providers that are supposed to be helping them to birth the baby that they're having. Right. And so that's why, we have, we've grown in women seeking doula support for that very reason.
Okay. And the disparities that we're seeing in healthcare are across the board. It's not just maternal health, but that happens to be our topic today. And if people go back and they look at some of the research that's out there and some of the latest publications that are out there, you will see that from the beginning of history, from 1619, it's been shown where there's always been this perception or this falsehood that Black people experience pain differently, that they have a higher pain tolerance. I remember in reading some history recently when I was made aware of the gentleman who's been given the who has the notoriety for creating some gynecological units, did experiments on enslaved women without anesthesia.
Exactly. And it's just appalling.
Right. And when you go back and that history has been perpetuated by what's been taught in medical schools, by what's been written in literature. So this is so important that women have this opportunity, as you said. I mean, giving birth to a child is like, it's incredible. It's like the highest high possible. And to go into that knowing that maybe you're not going to get the best care possible is it's unthinkable. It really is unthinkable. Yes. And it's beyond, I don't know, it's beyond even thinking about that you have to think about that.
Yes, while you're giving birth.
Time you're trying to give birth.
Exactly.
It's crazy. It makes no sense.
And so, And that's why, for many of you, you will see my interaction with our local city council. You may think, well, why would a doula and a lactation consultant be, concerned about things in the political arena? We can't do what we need to do if we don't have the system set up for what our families need. Paid leave, a living wage that
Right.
families can be able to provide. Just a decent living. Being able to not worry about having to try to get back to work within 2 weeks when we know that it takes about 6 weeks to establish not just establishing milk supply, but just bonding with your baby and
Mhm.
having that postpartum period, and knowing that the postpartum period actually is for the first year and not 6 weeks. Just so many things. And so our elected officials don't realize a lot of the decisions. Just for example, Medicaid expansion. Um, People don't realize when you have Medicaid expansion, it allows for families to be able to have doula coverage, have lactation coverage, have the coverages that they need to support their families. And so that's why you will see that this particular profession doesn't just stay in healthcare, it
Mhm.
morphs in all other aspects. In the business sector, in the political sector, in the reproductive justice, in the with our judicial system, because these are the things that affect our families, and those determinants have been known to affect health disparities in our communities as well. And because all of those systems are dealing with
Yeah.
systemic racism, the common factor in all of that is systemic racism.
Right. So, Angela, I know that you have another engagement this evening because you are a social activist. Um, so, before you leave, do you have a book that you would recommend, or that you think would be a good one for folks to start some of their research on, or start some of their expand their knowledge?
Well, there's tons of books that I have is more clinical, but if you want to understand what's going on, we talked about some of the articles that you brought up. This
Right.
particular book right here, Killing the Black Body,
Okay. Thank you.
and race, reproduction, and the meaning of liberty. And it really talks about, it kind of summarizes everything that we just talked about.
Okay.
And how, with the health, with other systems, how this all comes together and affects our communities. And if we're going to be able to deal with the issues that we have to start from being healthy. And that comes
Right.
from a healthy community. And the health starts from birth.
Right.
Matter of fact, before birth. And so that's how this all ties together. And so I look forward, if anyone, they have different platforms, if they want to email me or send me a message on any
Mhm.
platform, I look forward to answering any questions about how to get into this field, how to connect whatever current field they're in with this, and or just how to just get involved and volunteer or just be a
Right.
part of what we're trying to do in the community.
I thank you so much because I know that you've got a full plate this evening and have some other things going on. So, folks, I will have Angela's contact information and all of her social media in the show notes. I thank everyone so much for joining in. Angela, I thank you so much because this is a learning experience for
Thank
me
you.
also, and I know that you have to go. So I'm gonna thank you for going. Thank you,
Yeah,
excuse me. Thank you for showing up. Thank you for this
yeah, yeah.
wonderful interview, and good luck this evening.
And I was honored to be here. Thank you very much, and hopefully we
Oh,
can do it again.
okay. You're welcome. You're welcome.
Okay. Okay. You have a wonderful evening.
You too.
Uh-huh.
Okay. So that was Yeah, that was wasn't it a great discussion, Jenna? So I'm just going to, again, let you know that Angela's contact information will be in the show notes. But I also want to remind people that if you are interested in learning more about college and career planning, you can certainly subscribe to my newsletter. You can subscribe to my YouTube channel. This is the link for the YouTube channel. So I would love to see people go on there. And this video will also be live on the YouTube channel. It will populate if it's not up there already. And if you're interested in learning more or getting some monthly news about college and career planning, this is the URL for you to sign up for the newsletter, for the STEPS newsletter. So again, I thank you so much for everyone that was able to join us this evening. Again, thank you so much to my guest, Angela Tatum Malloy, who is one of the leading social activists in Fayetteville. And I really love the work that she's doing. And again, thank her so much. And thank you, folks. And I will see you next Monday, 7 p.m. Eastern Time, here on Facebook or on YouTube. Take care, everyone. And thank you again for joining in.